Member for Dartmouth South.
Thank you, Mr. Speaker, and I am pleased to rise and speak again about the need for a universal, public, affordable childcare system here in Nova Scotia. Mr. Speaker, when we discuss health care, as we of course often do in this chamber at this time, we often talk about pre-existing conditions. We know that the risk for people with pre-existing conditions of contracting COVID-19 is higher, that their risks of illness are higher. But let's loosen our focus and talk a little bit about the pre-existing conditions of our province. Nova Scotia went into this pandemic with some of the highest rates of poverty and food insecurity in the country, and with a staggering rate of child poverty. We know that despite economic gains, a significant portion of our workforce earns very low wages. We went into the pandemic with many people experiencing significant housing insecurity, with a healthcare system facing significant challenge, and with a marked lack of affordable childcare. It's now recognized, Mr. Speaker, as fact that COVID-19 has had an uneven impact on Nova Scotians, and that impact has been outsized for those living on the margins. COVID-19, Mr. Speaker, in a word, has intensified these pre-existing conditions. Mr. Speaker, when we received the budget recently, we were given a photocopy handout, 2 pages, that listed the $1 billion in appropriations that had been spent with no oversight from this chamber, loosely under the heading of recovery funds, to ameliorate the immediate impacts of COVID-19. The budget that we received was basically framed as a recovery budget. But recovery here cannot simply mean getting back to normal. We have the opportunity and the responsibility to build back better. We know that in this recession was not like other economic downturns. It wasn't a gradual decline in employment. It was an immediate loss of many jobs. Those jobs weren't lost because of external economic forces, but because of government-ordered closures. We supported those closures. We continue to where they're necessary. But those closures were concentrated within female-dominated, low-wage sectors. And this is really important to understand. This is unlike any historical recession, and this is why the term she-cession has been coined by economists, because this recession has impacted women specifically in a way that prior recessions have not. And partly this had to do with also closures in childcare and schools. Again, had to happen, but again, an uneven impact, we know, on women and particularly parents. These impacts are both hidden and exacerbated by the fact that we don't adequately measure or quantify the impact on women of the added burden of unpaid care and emotional labor. We know that this has most certainly resulted in economic losses for women, and a lot of those aren't going to show up in the GDP, they're not going to show up in the labor force surveys. But we know that this pandemic has made very clear our collective over-reliance on informal childcare arrangements, particularly those with grandparents and neighbors. These so-called organic arrangements are not available to everyone in the same way. We're going to hear that the government is talking to their federal counterparts, and we're always glad to hear about this, but we need action now. We saw millions, almost $1 billion of government money flow out the door because it was necessary, Mr. Speaker. Hundreds of millions of those went to roads and infrastructure projects in a recession that, again, Mr. Speaker, primarily impacted women and low-waged workers. And so what are we doing to help our social infrastructure recover, Mr. Speaker? Well, government kept childcare centres whole. They like to talk about that, and that's great. But let's think about what that means. They kept daycares open. They kept them from failing. So that's great, but it's also totally necessary. So while we are glad that that happened, we're stopping short of a rousing round of applause because so much more, Mr. Speaker, is needed. every time we talk about investment in social infrastructure in this House, Mr. Speaker, the government is apt to respond to say, well, we want to invest, but we also want to support the economy. So let's talk about the economic impact of universal childcare, Mr. Speaker. For every dollar invested in the childcare sector, there is a $2.23 increase in the GDP. This is 67% higher than the GDP multiplier for construction, the one industry that was kept as an essential industry and did not close during the pandemic, I'll note. On top of that, per dollar, the childcare sector creates more jobs than any other industry. 46.8 direct and indirect jobs are created per $1 million of increased spending in childcare. This employment multiplier is 220% better than spending in construction. I'm not picking on construction. Construction's great. We can have late debate about construction another night. I'm just saying, you know, that this is where government dollars are flowing because it's necessary, it's required. And so we're making the argument it's also required for us to have a universal, affordable, accessible healthcare system. And Mr. Speaker, while we're glad that the government is speaking to their federal counterparts, we note that Alberta, Newfoundland and Labrador, Prince Edward Island, British Columbia have all instituted their own provincial programs, and Quebec, of course, which is the model, of low-cost, accessible daycare without having signed that agreement with the federal government. And that ranges anywhere from $10 a day to $25 a day. But any of that is a vast improvement on the $45 a day average price that parents pay here in Nova Scotia for childcare. And I'll point out, Mr. Speaker, that only 20% of the operating funds for regulated childcare in Nova Scotia come from government at all. The rest is made up by parent fees, and that's why this whole system is untenable and essentially needs to be turned on its head. The government does have grant programs, but they are labyrinth and difficult to navigate, and a lot of people fall through the cracks. From our perspective, Mr. Speaker, government needs to do three things: address high parent fees, increase the number of childcare spaces available, and improve working conditions and access to training for early childhood educators. All three of those things can be accomplished with a wholesale revamping of the early childhood education sector. I apologize. If we take one lesson from the pandemic, Mr. Speaker, it's that we can't continue to allow this foundational piece of our economic and social systems to be addressed in a patchwork manner that results in differential access to care and downloads choices onto individual families when they're better addressed at a systemic level. We hear stories about issues to do with this all the way from Sydney to Yarmouth and everywhere in between. We need a provincial view. This is a province that, for better or worse, has consolidated a lot of its operations in that way. One of the arguments for getting rid of school boards, for instance, was we'll be able to do things in a streamlined manner. We'll be able to apply everything across the province. That's what we're asking for. This government did it with pre-primary. We voted for pre-primary. We said at the time that the introduction of pre-primary would destabilize the rest of the early childhood education centre, Mr. Speaker, and that is what we've seen. So we are asking government to continue down the path that they started and to implement a universal, affordable, low-cost system of early childhood education for all Nova Scotian families and children. Thank you, Mr. Speaker.